So now for the next category of drugs, which we'll get to look at their pharmacology. Okay, trying to look at the different categories of drugs, and the examples that basically fall under those drugs and all of that. So we are looking at what is known as the emetics and the antiemetics. So emetics is basically vomiting. So if I say a drug is an emetic, it's a drug that is promoting vomiting. Do you understand? Then of course they are not really needed, except probably you took in a poison that you need to actually take it out ASAP. If not, these drugs are not really needed. Then we have the antiemetics. These ones are against what? Vomiting. So for the emetics and antiemetics, we say that there are drugs that stimulate vomiting. They are rarely used today. Okay, so the emetics, they stimulate vomiting, but they are used, maybe taking poison, they need to actually take the poison out so quick and all of that. Examples, we have drugs like the apomorphine. It's a dopamine agonist, acts on the chemoreceptor trigger zone. It was used before to induce vomiting, right? It's rarely used today. We're talking about emetics before we talk about antiemetics, right? So this is what apomorphine. We have another one, Ipecac syrup. So Ipecac syrup is derived from plants. It stimulates gastric, mucosa, and also the chemoreceptor trigger zone. It's using it's used for poisoning. Do you understand? The poison you need to vomit quick. Ipecac syrup. Then the antiemetic drugs, those ones are the most important ones now. These ones, they will stop vomition. Okay, so they suppress nausea and vomiting, they act on the vomiting centers and all of that. Examples, we have antihistamines, H1 blockers, Other ones, we have the diphenhydramine, so drugs like what? The meclizine, the promethazine. Okay, this is what? Okay, this is diphenhydramine. Okay, so there is in treating motion sickness, vestibular disorders, and all of that. Okay, then anticholinergics. So those ones are used in treating motion sickness too. Okay, so drugs like scopolamine. Okay, then we have the dopamine D2 receptor antagonist. So drugs like the metoclopramide, the domperidone, the prochlorperazine. Okay, so those ones, they are used in treating all those chemotherapy-induced nausea, postoperative vomiting, gastroparesis, and all of that. So that's what we got for this. That's what we got for this. So we got for this.